broadcast of the regular meeting of the Public Health and Safety Committee will now begin.
Good afternoon, everyone, and welcome to the regularly scheduled meeting of the Public Health and Safety Committee for December 10th, 2020. My name is Philippe Cunningham, and I am the chair of this committee. As we begin, I will note for the record that this meeting has remote participation by members of the City Council and City staff as authorized under Minnesota Statute Section 13D.021 due to the declared public health emergency. At this time, I will ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Gordon?
Here.
Cano? Will be absent. Ellison?
Present.
Palmisano?
Present.
Fletcher?
Here.
Chair Cunningham?
Present.
There are 5 members present.
Let the record reflect that we have a quorum. Colleagues, we have 8 items on the consent agenda for today. I will go ahead and read through them and see if there is any discussion before we take any action on them. So for item number 1, it is accepting a grant from the Minnesota Department of Health in the amount of $52,768 for enhancing influenza vaccination coverage as a part of COVID-19 response work. Item number 2 is accepting a grant from the Minnesota Department of Health in the amount of $2,916,670 to work in partnership with the Minneapolis Department of Health to address the areas of public health responsibility and essential public health services. Item number 3 is approving council and mayoral appointments to the Public Health Advisory Committee. Just for my colleagues to reference as well as the public, you can actually go to the LIMS system and under the RCA or request for council action, you can find brief overviews of each of these applicants. Item number 4 is authorizing an increase to a contract with Dial Group for Create Changemakers Apprentice program in the amount of $2,000 for the total to not exceed $20,000. And this provides underserved people of color in Minneapolis high quality leadership program opportunity, training them to leverage art, culture, and creativity to solve community issues. Item number 5 is approving council and mayoral appointments to the Minneapolis Workplace Advisory Committee. Item number 6 is accepting a sexual assault kit initiative grant from the U.S. Department of Justice in the amount of $2 million to determine the DNA analysis of backlogged sexual assault evidence kits, support victim contact, case investigation, and prosecution of cases as indicated by the new DNA evidence. Item number 7 is passage of a resolution amending that is entitled committing to donate 2 fire trucks to the Minneapolis's sister city of Cuernavaca, Mexico, which passed on November 8th, 2019 by removing the reference to the year when the equipment will be donated. This is a result of COVID and other challenges that prevented this from happening. Item number 8, the last item on the consent agenda, is approving a change to the geographic area where Northern Metals LLC settlement funds for health education and mitigation strategies around lead poisoning and asthma can be spent by enlarging from the neighborhoods of Hawthorne, McKinley, Bottineau, and Sheridan to all of the north and northeast neighborhoods, which will allow for efficiency of advertising and service delivery to a wider geographic area that is consistent with the terms of the settlement decree. Is there any discussion on the consent agenda, or are there any items that anyone would like to pull off for discussion? All right, seeing none, I'll move approval of the consent agenda and we'll ask the clerk to please call the roll.
Councilmember Gordon?
Aye.
Cano is absent. Councilmember Ellison?
Aye.
Palmisano?
Aye.
Fletcher?
Aye.
Chair Cunningham?
Aye. Aye.
There are 5 ayes.
That carries and the consent agenda is approved. Now we'll move on to our discussion items. We have 3 of them today. The first 2 will be presented by Andrew Hawkins of the Civil Rights Department, and then we will move into our monthly regular update related to COVID-19 that will be given by our Commissioner of Public Health. So the first item is approving council and mayoral appointments to the Police Conduct Review Panel. I have asked civil rights staff to give us an overview about what this work is and the appointment process, and to speak a little bit to each of the appointees that are being recommended. So with that, I will now pass it over to Andrew Hawkins from the Civil Rights Department to be able to dig into the Police Conduct Review Panel. Thank you.
Chair Cunningham, thank you. I'm happy to be here today to speak to some of these items and answer any questions that the group might have. So to start off, I guess we'll go to the Police Conduct Review Panel. The function the Police Conduct Review Panel plays in the police oversight process, it's a joint panel. It's 2 sworn officers and it's 2 civilians, and the actual PCRP itself, it's not a standard committee where it's going to meet regularly. You know, there's scheduled meetings. It's considered a pool of candidates, and so for these review sessions, what's actually done is that there's a pool of sworn members, and then there's a pool of civilian members. 2 members from each group are selected to participate in the review panels, and so the review panels themselves, so that you understand where they fit in this process. When a complaint's received, all the complaints, any complaint against MPD is taken in by a civilian intake investigator with the Office of Police Conduct Review. The job of that person is basically to start to build out some of the facts of that case, sort of figure out, confirm locations, confirm officers. We also have a body camera analyst who will kind of go through any body camera that's related to this incident, just to verify again, locations, what occurred. This basically sets up kind of the initial investigative case that goes to the joint supervisors for review, and that's the Director Amani Jafar of Office of Police Conduct Review, and then Commander Wheeler with MPD. During those sessions, they'll review all of the cases that are brought before them and kind of make decisions. If some things are sent out for coaching, other things are referred on for further investigation and potential discipline. Once those are investigated by either sworn or civilian case investigators within either Internal Affairs of MPD or the Office of Police Conduct Review, that's where the review panel comes in. Every case, once it's completed, will go to the review panels so that this group will be called to order, sit down with a slate of cases to review. They'll review all the facts of the case, any body camera that was available for it, and then it's their responsibility to make a decision of merit or no merit, which is the limit of civilian oversight as set forth by Minnesota state statute. Once a decision of merit or no merit is made, the case is then moved on to the chief of police for a decision to be made. There is another process that takes place within the police department. It's called there's a Loudermill hearing. Where I think the officer has a chance to respond. Obviously, I'm probably going more into detail than this actual panel, but I feel like it's a worthwhile conversation anyways. But so the Loudermill hearing will happen. They'll review the decisions that were made by the panel. It will then go to the chief's desk, and he will make a final decision on discipline. So again, hopefully that kind of helps understand where this group fits in the process. So now to speak to the actual applicants that we had this year. We have 3 people that were moving forward. One of them actually was invited to be here today, but can't because she's actually in a panel right now. And so I can just start with her. So that's Nak Nguyen. She's an attorney with Human Services. She's been on the panel for, I think, quite a while as well. And we were very fortunate that she was interested in coming back, since it's always nice when you have those people that have that experience of how the process works and have that understanding, and you can keep them convince them to come back, to keep serving the city in this capacity. Our second person we're putting forward is Jim Jacobson. Jim's currently he's an attorney for Medica. He has a very extensive public service experience. And I believe a number of people that were on our interview panel were familiar with him just through various community engagement opportunities. So we were happy to have anytime we can get people that have that that good experience and that analytical and investigative kind of background, they add a lot of value to the panel. And then our final person that is being put forward is Diane Moe. Diane actually recently retired from the Minneapolis Park Board, but she has, kind of spent her career working, in the community and with, members of the community, the solving problems, the dealing with citizen complaints. These are all things that, generally are looked for and highly valued with candidates for the PCRP because, they're going to need to apply that kind of objectivity and problem solving skills, every time they sit down to review a case. So I believe that I've covered those three and the purpose. If there's any other questions on that are specific to the PCRP, I'm more than happy to stand to answer those now.
Thank you. So I appreciate the detail and how it fits into the broader picture. I think that for a lot in the public, folks don't fully understand what does the oversight and accountability look like in the context of the OPCR and the various bodies that are related to it. So thank you for doing that. Can you explain, you briefly, I think, spoke to this, but can you explain a little bit more about how this fits in alongside the internal affairs investigation?
Sure. So OPCR and the structure that exists right now for the Office of Police Conduct Review, when a complaint's made to the City of Minneapolis, residents have the opportunity to identify if they want a sworn officer or if they want a civilian or investigator to do the investigation of the case, or they can select no preference. And so then when those cases are routed, if you select no preference, it'll just be routed to whoever I guess has the most capacity. So if it's IA, it'll go to IA. If it's our staff, it comes to our staff. And then as far as the joint supervisors go, yep, it's the commander of internal affairs is basically sits alongside the Office of Police Conduct Review's director to review these cases, and like they'll bring that like their perspective from law enforcement like to that conversation and their experience with that, and Director Jafar will bring like her background and extensive experience from the civilian side as well, and so they're able to discuss like where they think this case should go. If there is any disagreement, the opportunity is there to elevate the issue to the Director of Civil Rights for additional discussion. But at least as has been my experience, fortunately they're able to come to a agreement and be able to move things forward expeditiously. In terms of the IA involvement with the review panel, it's not specific to IA. There's just a pool of candidates that's brought forward by the police department. I believe they've actually made the change recently that they're all, I don't want to get this wrong, but I can't remember if it's commanders, but it's a higher rank. So they're bringing in people that have a little more seniority and a little more experience, which is beneficial to this process, since it's helpful to bring that perspective to those discussions. So there's two sworn officers, two civilians. They'll go through every case together. If there's any questions, they have the ability to talk to the investigator of that case to kind of clarify anything or add context that might be necessary. And then they move the case on. So I'm not sure if hopefully that covered some of your question. If I didn't, I'm happy to try again.
No, that was great. Thank you. The purpose of this is to be able to help have us have a little bit more clarity so folks can connect the dots around the city's police oversight mechanisms and processes. So thank you so much for that item there. Are there any questions or comments from my colleagues related to the Police Conduct Review Panel? Councilmember Gordon.
Can the panels ever interview witnesses, or the complainant come in and talk to them about the complaint, or do they just rely on the investigative report?
Councilmember Gordon, my understanding of the PCRP and the way that it proceeds is they'll use everything that was taken by the investigator during that, and that should almost always have witness statements and anything that was, I guess, contributed to the case file itself. So they'll have that available to review, and then they can consult with the investigator of the case as necessary.
So in other words, they don't actually talk to the complainant or any witnesses, and they don't actually talk to the officer that was involved in the incident?
Yes, I believe that's correct.
If somebody requested to have a review panel that was only civilians, and not, and I realize our police are also civilians, but I think you understand what I'm saying, not licensed police officers on the review panel, would they have that opportunity?
I believe the current structure of the PCRP is, I don't know what the agreement or if that's set somewhere in the ordinance, but that's something that I do not know is an option at this point. So, but it's absolutely something that you could explore.
Do we happen to know what the results are of the decisions? Are many of them 2 versus 2 where there's disagreements on the panel, or is that recorded anywhere?
I believe we have a record of the way that, and so there's a form that they're asked to fill out. Usually, before a meeting begins, they'll elect, a chair to preside over that session. I believe they alternate. So for one, for one session, it'll be a civilian. For the next one, it'll be a sworn. But there's a form that they complete that does record the, everybody's disposition at the end of the investigation. In terms of if there's splits or not, I actually, at least recently, I believe that they have not had any issues with, severe disagreements that stopped it from moving forward. They could generally, I think, come to the same conclusion. But it is something that does happen where we have a split, there could be a split decision.
Is that public information so we can see how the decisions are done, or is that private?
I believe that the outcomes of review panels is available on our website. I don't know that it's necessarily specific to the cases, but just to see if there were splits or, notice if things were remanded back or if it was sent forward with merit or no merit. I do believe, and that's absolutely information that I can look into and provide to you after this meeting.
Can the Police Conduct Oversight Commission review the findings of all the investigations of the review panels?
Nope, I do not believe that's possible. So the PCRP, the way that it's set up right now and the way that this process works, it's based on the guidelines of the Minnesota State, I think it's statute 62689. It's the Peace Officer Discipline Process, as well as the Minnesota Data Practices Act, which is 13.43, comes into play as well. It's considered an administrative enforcement process. It's similar to an HR investigation. So because of that, there's certain data privacy and like data restrictions as far as what's made publicly available.
Thank you. I think that's enough for now. Appreciate it, Mr. Chair.
Thank you, Councilmember Gordon. Next up, we have Councilmember Fletcher.
Thank you, Chair Cunningham. We've gotten some detailed questions about appointment processes lately as we've been appointing people to these commissions. So I wonder if we can just describe in a little bit of detail. And I want to be very, very clear that I think we've got terrific appointments here, and I appreciate the service that all three of them are offering to our city. So I'm not criticizing the outcome in any way. I just want to make sure that we have an explicit discussion about how people were appointed or how did they apply, who reviewed those applications, and just create a little bit of transparency to answer some questions in advance that I imagine might be coming based on the last couple of appointment processes and some of the questions we've received. You can just describe how we got to the outcome that we're approving here today, and what qualifications maybe are required for the position.
Absolutely, yeah. Vice Chair Fletcher, I'm happy to speak to that at this point. So much like everything else in 2020, there's been some unique challenges to this working, having a lot of staff remote. We've had some hiring freezes that have impacted our capacity in various divisions within civil rights. So for this process, we actually kind of presented an opportunity to do things a little bit differently than we have in the past. And one of the, what we elected to do, we have the Civil Rights Equity Division that's responsible for overseeing our Urban Scholars Program. I believe all of you are familiar with the Urban Scholars Program, but a major part of that is receiving, taking in both recruitment, but also bringing in a lot of a very diverse range of candidates. They have to do those extensive interview processes. So this is a group that was in a very good position, fortunately for us, to step into this and kind of help us, maybe rethink the way that we've done this in the past. So I haven't been involved, prior to this cycle. I've kind of assisted with, things as needed, or sat in on interviews if they needed people, but I haven't been this directly involved before. So it was very interesting to kind of get to see, this process take shape. And so one of the first things that the Civil Rights Equity Division did was sort of establish the principles for what this process would look like, how we screen applicants, what do we value, what are we looking for in candidates. And so Director Jafar provided a little bit of insight into kind of what they've done in the past, what like qualifications have been very helpful in certain roles. And I think they kind of took that, ran with it, and then where they landed was, the kind of the pillar principles to this process have been the focus of racial equity, geographic diversity, diversity of perspective, and then also the fit to the purpose. So, it's, if you're going to be a member of the PCRP, like, it would be good that somebody, has that kind of objectivity and, belief in wanting to better this process and, become involved and be objective, and that would obviously be necessary in a good candidate. So specific to the PCRP, that was, a similar focus was used for the PCOC with those same guiding principles. One of the first things we kind of identified was that there's been a lack of representation on the PCOC. There's been some wards that haven't been represented in, to my knowledge, maybe ever, or, for quite some time, which, doesn't, especially given our current, landscape and environment, doesn't seem acceptable. So that was something that we wanted to remedy. So those principles also were put in place for that process. Again, racial equity, geographic diversity, diversity of perspective, and the fit and purpose. I know there's a wide range of views on policing and police oversight, but you still have to have like that kind of degree of objectivity or willingness to kind of work within the process to make things better in order to be a good fit. So we did have, I believe we had over 40 applicants. There's no chance we've had that many before. Cred did a wonderful job of doing outreach. I know a number of the council members as well have done outreach within their wards. This is the most representative group I think we've ever brought forward. Of the 40 or 42 candidates that we had, I believe we conducted interviews for at least 20. And so, of those 20, we brought forward, four proposed PCOC members in a previous council session, and we're bringing forward 3 today. There weren't any PCRP candidates in the prior cycle, but we have the 3 before you today.
Andrew, if I can just jump in right quick, can you say who the we are? When you say we interviewed, we forwarded, can you say a little bit more about who that we is?
Absolutely. I'm happy to. So, and yeah, I kind of forget that people aren't always in my head. So if it doesn't make sense, feel free to interject and stop me and I'll make myself as clear as possible. So when we set up, when we as in the Civil Rights Department and Civil Rights staff set up these interviews, this kind of remote environment provided a unique opportunity for engagement and involvement from mayoral and council staff. I think that we haven't necessarily had in the past. Like the meeting invite would be sent out, but it's a lot bigger challenge. When we're on site and you have to be jumping from meeting to meeting. So this remote environment gave us, a better opportunity to make sure that we kind of like put the ask out there for people to get involved and see some of these candidates and learn more about the process and how it worked, just kind of in the interest of transparency. So for the interviews themselves, we had sent out invitations to the members of this this committee, as well as more staff to both end of the mayor's office and mayoral staff. And then we also extended an invitation to, I think, all the remainder of the council, just in case they wanted to send staff just to participate, not necessarily be in part of the interview, but just to kind of, listen in and see what, see how things are going, see if there's any ward, that they represent that had a member being interviewed. They were definitely more than welcome to jump in on that one just to see how that one went. And so I think that was a very big success. We definitely had more engagement from council and mayoral staff than we've ever had in the past. We went through the interview process, and at the end of it, it was actually kind of put to those that were participating to, share their thoughts and opinions on those that we had interviewed and sort of see kind of if anybody rose to the top. And that led us to how we, the candidates that we brought forward.
Councilmember Fletcher, did you have any follow-up questions?
No, but thank you for that detail. And I'm glad to hear we had so many people interested in this kind of service and that we were able to select some really good people. Thanks.
So are all of the seats now filled for the police conduct review panel?
Chair Cunningham, I will have to go check. There may still be 1 or 2 seats available. And I guess the interesting part with the PCRP is the fact that because it's not a standing body that meets regularly, it's a pool of kind of people at our disposal. The more people we have, the more qualified candidates that we can put forward that we have, in this decision-making body, it provides a better opportunity to schedule the review panels as necessary to get through cases expeditiously. So I think that it's definitely something where we're always interested. So if any of the council members have, ward members that are interested in this opportunity, send them our way.
Great. All right. Thank you. Are there any other questions or comments for Mr. Hawkins related to this item? All right. So I will then move approval of the council and mayoral appointments to the police conduct review panel. And I'll ask the clerk to please call the roll on item number 9.
Councilmember Gordon?
Aye.
Cano is absent. Ellison?
Aye.
Palmisano?
Aye.
Fletcher?
Aye.
Chair Cunningham?
Aye.
There are 5 ayes.
That item carries. Thank you again, Mr. Hawkins. So now we're going to go ahead and move on to the next item. So thank you for sticking around. The next item is the confirming mayoral and council appointments to the Police Conduct Oversight Commission. And so again, looking for an overview of what this body does, being able to explain a little bit about the candidates that you are bringing forward for recommendation, and then what did the appointment process look like. So the floor is yours again.
Sure, Cunningham, thank you. I'm happy to speak to this component as well. As for the process, I can actually just start there since I just went through some of this. We followed the same process for both of these and kind of did them as parallel processes to bring in candidates and do interviews, because obviously understanding that everybody's time is can be a scarce thing lately with everything that's been going on. We wanted to make sure that we maximize our opportunities that we had to pull in council and mayoral staff. So the process itself, the Civil Rights Equity Division did a wonderful job putting together the criteria for what they were looking for in candidates, and kind of helping sort through everything and then getting interviews scheduled. So it was, again, very similar. Again, if there's more that people want to know about that part, I can speak to that once I'm through the rest of the material. The Police Conduct Oversight Commission it's a public-facing body. It's a commission made up entirely of civilians. One of the primary, I think, tools that it has is through research and study. Some of the studies that it's performed in the past have involved topics such as evictions and calls for service, body-worn camera audits, and recommendations for MPD policy as it relates to body-worn camera, domestic violence response, mental health and policing, but I mean, all very relevant topics. And I think it's kind of the closest thing we have to, preventative like measures where, they can do these research and studies, identify trends or patterns and practices, and then make a recommendation so that, there could potentially be some policy changes to avoid, some of the issues that they have identified to be occurring. They also serve as sort of, for lack of a better term, I guess a gathering place for public opinion, or, for people to kind of, like listen in, provide comment, and kind of become involved in the civilian, the civilian only group that, on discussions of policing, which, I was, one of many people that viewed the meeting, your extensive meeting last night, and obviously there's a lot of opinions around policing right now, and this is just one more opportunity for people to, to basically make their voices heard, which I think is a very valuable tool to have. As to the actual applicants that we had that we're bringing forward to you, the first one, John Sylvester, is from Ward 4. He's a paramedic EMT. This is actually something that we haven't had. This is, he represents an area that we haven't had in the past, but that is incredibly relevant and incredibly valuable, I think, to this discussion that's, taking place right now. He had expressed, he frequently, and just as a part of his job, he interacts with law enforcement. He's seen, some interactions that are problematic, or some issues that he thinks need to kind of be raised and can be corrected and can be bettered, and that are important for us to discuss, in a public forum such as the one that PCOC provides. And it's just, a big public health and safety focus, which is, definitely something of value. Our next candidate is Jordan Crockett. He's from Ward 9. And one of the underlying things with Jordan is that he's very big on wanting to serve his community. He's involved with Big Brothers Big Sisters and mentorship programs. And then he also spoke to his experience as a young Black male in this just kind of growing up in the city of Minneapolis. But also the fact that he's just bought a home in Phillips. He's wants to become part of the community and kind of work to be improve relationships and I guess the situation for residents as a whole. So that, I think that was very powerful for I think the panel to for him to share his perspective. And then our final applicant is Carrie McGuire. Carrie's an immigration attorney, and so again, like bringing a very unique perspective. One of the things that Carrie's also from Ward 3. She spoke to a desire of wanting to better systems for the communities that she's involved with, that she sees on a day-to-day basis. Obviously, there's and she also kind of made the distinction that while she does work with a lot of these communities as part of her job, she kind of views this as not an extension of her work, but just as something that's become very personal to her, where she's seen some communities that are impacted disproportionately in their interactions with law enforcement. And so I think that bringing that that kind of voice for that population will be something that's certainly adds value for this group.
Awesome, thank you. I'll just say my excitement about John Sylvester, who is from Ward 4. He reached out to me and we've talked extensively about whether or not he felt like he was the right fit, and I've just been very excited about having him be on this body. So very excited. Are there any questions or comments from my colleagues related to the Police Conduct Oversight Commission appointments? All right, I'm not seeing any. Thank you for all of the work that you, your team, folks from across the enterprise who participated in making these appointments happen. The work that you all do is really critical, so I appreciate all that you have done. So thank you for that. And thank you for being here to be in conversation with us. With that, I will move approval of the Police Conduct Oversight Commission appointments, and will ask the clerk to please call the roll on item number 10.
Councilmember Gordon?
Aye.
Kano is absent. Ellison?
Aye.
Palmisano?
Aye.
Fletcher?
Aye.
Chair Cunningham?
Aye.
There are 5 ayes.
That item carries and that motion is approved. So for our last item today, we will be receiving and filing an update on COVID-19, our regular monthly updates related to this global pandemic. Our presentation will be the presentation will be given today by our Commissioner of the Health Department, Gretchen Musicant. So with that, oh, I'm so sorry. I missed Councilmember Palmisano. My sincerest apologies. Councilmember Palmisano, did you want to go back to the previous item? I'm sorry about that.
No, if I could just say, and no problem, I think we might all be tired today. I just wanted to share that Andrew Hawkins and Maria Lee did such a great job organizing these remote interviews for all of these positions. I made it a priority to be part of the OPCR and PCOC interview process personally, and had one of my staff in these calls too, and other wards participated as well. It made our choice. We had very difficult choices to make. Because we had so many great candidates. And so I wanted to thank everybody that even applied. So not just city staff, and my congratulations to those that have been. I think we've created a new start for these committees, but also just the strength of all of the applicants really gave us a lot to look forward to. So that's all I wanted to say, Mr. Chair. Thank you.
Thank you, and my apologies again for missing your name in the queue. So moving on to the COVID-19 update, Commissioner Musicant, are you on the line?
I am, thank you.
Oh, all right, welcome, the floor is yours.
All right. So I'll give you an overview, and just a reminder that some of the statistics I'm going to share with you are how things have changed in the last month. And so hopefully that will help us get a sense of from each report to the next. This week happens to be National Flu Vaccine Week. And so we are encouraging people to continue to think about, even as we're leaning into the possibility of COVID vaccine, to think about influenza vaccine and to get your flu shot now. It will help you through this season, and it will also make it easier to figure out if you do feel bad, if it's likely to be the flu or COVID. So I encourage people to do that. Next slide, please. So since last month, we now have over 25,000 confirmed cases, and that's a 74% increase since last month. So it shows you that we are in a different era of this outbreak than we were even a month ago. And the cases that we've seen in November have been more than a third of the total cases we've seen since March. So really, it has been exponential growth in the number of cases. And we're seeing that increase across all age and racial and ethnic groups. The increase in hospitalization and ICU admissions is not as dramatic as the number of cases, and we expect that. It's a little bit of a lagging number, so that we see the cases go up first, and then we start to see more hospitalizations and more use of the ICU. So far in Minneapolis, there have been almost 300 people that have died. And if you look at the rate of death in November, there were 35 deaths in November. That's more than 1 death per day from COVID in Minneapolis. 85% of the deaths are still amongst those 65 and older. Next slide, please. So this is a graph that shows you that exponential growth, that upswing. Luckily, we are also seeing kind of a flattening and a decrease. We do wonder and worry about a slight increase occurring after Thanksgiving and maybe being the start of yet another larger increase. And so we'll be watching what you see at the end of that graphic. So the blue line is Minneapolis, and so we have a rate of 58 per 100,000, and the state as a whole has a rate of 84 per 100,000. We are in the red zone, clearly, which is not where we want to be. Most of the pandemic that we've experienced since March, if you'll notice that graph, we have not been in the red zone. So we've been in the orange or in the yellow. So it's quite a recent phenomenon to be up in this red zone, and we are doing everything we can, the governor's order and other measures, to get us back down into the orange, the yellow, and hopefully the green. All right. So one of the major tasks we're doing is case investigation and contact tracing. But because of the sheer volume of cases, we are getting about 300 cases per day in Minneapolis. And we are really only able to interview about 60% of those just because of the sheer volume. So we have a team that is working, and there are 54 people overall on our team. They average 80 interviews per shift. They might make as many as 100 or more calls. We have on average about 15 of the folks working. It's really a tough job. It can't be done 40 hours a week, and so we do rotate people through. In order to meet that large volume that we have now because of the number of cases in the community, we would need 40 staff per shift to keep up with the current caseload. And we are not the only ones that are not keeping up. This is a phenomenon across the state. It just really tells us how important it is to get that case number back down in the community so we can really make use of a tool like case investigation and contact tracing to manage the outbreak. We have reassigned our food, lodging, and pool staff to almost exclusively be on these teams and step back from their normal inspections. They'll still be responding to complaints and helping businesses that want to modify their businesses or open or expand. But we have got all hands on deck to try and keep up here. Next, please. So next, another major piece of our work is thinking about vaccinations. And so we're learning more and more, and there's a great deal of hopefulness about what's coming. We expect even today, and perhaps it has already happened today, and I'm just not up to date on what's happened today, but to get approval, federal approval for the first vaccine distributed by Pfizer. And we expect, like within a week, to get another approval on another manufacturer, Moderna. And so that will put in place vaccines that we can begin to use for the various priority groups, which I'll talk about on the next slide. But the vaccine itself will be paid for. The administration of the vaccine and all the bookkeeping and paperwork required to keep track of people and make sure that they're getting a second dose from the same maker as the first dose. All of that is not necessarily paid for by the federal government, but we will be seeing mechanisms so that everyone will be able to get vaccine with or without health insurance, although we'll be looking to bill insurance for those who do have it. We're learning a little bit more about side effects. So about over half of the folks that have received that first vaccine from Pfizer have reported side effects. They're usually sort of quote unquote normal immune responses. So the kinds of responses you might get after getting a vaccine for some other disease, either flu shot or measles or any other vaccine. There's also a great deal of questioning going on about will people be required to have vaccines, and there will be no government mandate for people to get vaccines. Next slide. So we have submitted our plan to the state this week, I believe. It's still, the 4th was on, or last week, late last week. Our plan is focused on responding to how are we going to get the vaccine out to these priority groups. And so you'll see there's priority 1A, 1B, and 1C. The first one, 1A, being healthcare workers and long-term care residents. So healthcare workers includes an array of folks, including long-term care facility staff, and then residents. Critical workers includes things like first responders, public safety and public health staff, food and agricultural workers, and so on. And then 1C includes people aged 65 and over, those with underlying conditions, people from racial and ethnic groups that have been shown to be disproportionately impacted. So really, by the time we get through priority 1C, we will have been able to reach a large proportion of the overall population. We're going to need a lot of partners to get this to happen. And so we have been finalizing a contract with Hennepin Healthcare, the Minnesota Visiting Nurse Agency within Hennepin Healthcare, to administer the vaccines for us. We are also working closely with community clinics to make sure that we can support what they're doing, and they might also be a partner with us. And then we are in close communication and coordination with Hennepin County, Bloomington, Edina, and Richfield, all of whom have their own health departments, so that we can align our messaging, so that we can share information about each other's vaccination opportunities, so that we can build on each other's outreach tactics, and so on. Next, thank you. So one of our focus areas thinking about vaccine is not only how are we going to get it out, but how is it going to be perceived and accepted by the community. And so we are sharing information as it's available through community presentations, working through various established relationship channels, as well as radio programming. And there is a survey that's currently open through the end of December, where we're gathering input from people about their concerns, their thoughts, their past experiences with vaccines, so that we have a really clear picture of how people in the community are approaching this new vaccine. And we have 27 community members who are trained as vaccine liaisons, and they are reaching out to the community and also will be very useful in helping us craft our messaging and delivering it as well. Some of the messaging that we're hearing from the community are concerns about there hasn't been any testing yet for children or for pregnant women, and so those being very important groups, and not having vaccine availability or any research about how the vaccine works in those populations, I think is a concern to folks. There is concern in the community about whether or not there would be mandates, either from the government or from employers or other settings. And we do see that there is a disproportionate number of folks who have vaccine hesitancy in BIPOC populations. So we want our message basically to be that we acknowledge the trauma and the hesitancy that people might have, but also focus on how the community well-being is dependent on protecting ourselves and others through vaccines. And we are planning to work with faith communities and others to help with establishing a connection between trusted messengers and the kind of information that we're able to tap into. Next slide. Oh, I think I covered this. Okay, next slide. I have an old version of slides in front of me. So the next update is we have completed our use of the CARES funding that we needed to use by mid-November. And so the health department has reported basically using around $8 million in CARES funding. A little over $4.5 million for the personnel, redeployment of our own staff and special activities that we have done above and beyond. We purchased a large number of saliva tests, 2.2 million, and are using those in a variety of ways. I'll talk a little bit more about those in a next slide. We purchased some personal protective equipment and other materials, and also expended $500,000 on community food security. Some of the things that we hoped to spend CARES money on, especially some of that food security, we didn't quite make the deadline, or community agencies weren't able to make the deadline, and so we're working through how to identify resources to make sure that the community can still be helped in that same way. Next, please. So now that that funding has ended, we know that the response is ongoing well into next year. And so we want to make sure that we have an eye on resources that can help us with that. The state awarded us some funding back in March, and we have until the end of February to use that funding. And so there's about $100,000 of that remaining. We have received a grant from DHS to address COVID amongst the homeless population. That was $36,000. We have basically expended that. There's a Department of Justice grant that we got through the MPD, the two of us together. And so we received about $175,000 from that, and we were able to spend that into January of 2022. So we'll be looking at that as a flexible source of funds for supporting personnel, testing, and supplies. And then on the horizon, we expect to get some funding from the state for, it's not this horizon, it's back on the last slide, but that's okay. We expect to get some funding from the state to help with vaccine planning, distribution, and we think that'll be about $77,000. That should be coming very soon. And then we expect an additional $69,000 from DHS to do some additional work as well. And so we'll be looking at the timelines for those. And of course, we're very hopeful that there will be additional federal dollars made available. Now on this horizon. So we continue, in addition to doing contact tracing, planning vaccines, to do testing events. And we are trying to do those in places where we believe people don't have easy access to some of the other sponsored testing events. We're doing those with saliva tests. And so we're hosting 9 free events in December. And we are also recruiting enterprise staff, so other employees within the city, to help with some of these testing events and then vaccine events when those come up. And so far, there have been 22 people across the enterprise that have volunteered to help us out, often on work time. So it's volunteering just means, yes, I'd like to do that. It doesn't mean they have to do it without pay. And then we continue to work to refresh messages because we all feel very exhausted, can't believe how long this has gone on, don't really have, you know, the curiosity and energy to listen to messages anymore. And so we are working with communications and always trying to refresh the messaging, and then also helping people think about the holidays, the winter holidays coming up, and how people might engage in those safely, mostly by staying home and just being with their immediate family. That's my report for now. I'll stand for questions if there are any.
Great, thank you, Commissioner. One of the things I really appreciate is the level of detail that you include in these presentations so that we're able to really get a full understanding, not only as council members, but also for the public as well. So thank you so much for that. Are there any questions or comments for Commissioner Musicat? Councilmember Fletcher.
Thank you, Chair Cunningham, and I'll add my thanks for this presentation. I know this is on everybody's mind, and I can never resist asking you the crystal ball question, which I know is something that hopefully is getting less and less difficult to answer as we get closer on knowing vaccine timelines and having those vaccine plans in place. But I guess I wonder if you could just provide a little bit more about the current thinking in our planning on how long do you think it will be into the distribution process for people who don't see themselves on that list of priority vaccinations, for people who will be waiting until the vaccines are more widely distributed. How long do you imagine that will take? And then how many of us need to get the vaccine before we feel comfortable basically telling the public it's okay to be out again, and we can really ease social distancing restrictions and start going back to offices and public spaces and restaurants and all that kind of stuff. What percentage of vaccination do we need to get to before we can start having that conversation?
Yeah, thank you for those questions, Councilmember Cunningham and Fletcher. The foggy crystal ball question, I guess would be maybe by March or so on. Truth be told, in that category 1C, we're going to have a whole bunch of us feeling like we have access through that category, even though we're not the general public. Some of that will depend on how quickly the supplies come out. The supply of vaccine comes out and can keep up with demand. We expect that pharmacy chains and all sorts of places will, once it's supplied, will be available for people to go to, in addition to any clinics that we might sponsor. So yeah, I think about March-ish, we might see more general availability. Let's see, your second question. Oh yes, what kind of coverage? Generally, what we believe is the best for the community would be 90% immunized, which is challenging when we think about how people feel about the vaccine and worry about it and have questions. I think it's helpful that the first, the 1A priority will be healthcare providers, because they are perhaps closest to the notion of vaccine and also are seeing firsthand the risk of the disease, and so will probably have very good uptake. And I think they will be helpful ambassadors for us to hear about how did that vaccine go, how did you feel, any kind of unusual things we might learn about the vaccine. So I think that will help with people's acceptability. So while the vaccine is just so important in getting us to a place where we can actually feel more freedom to do the things that we remember doing together, I think the cautions that we're taking right now to pull down that rate is almost as important as the vaccine. If we could bring the community rate back down to yellow and below the orange and into the yellow, we could probably feel freer again to do some of the things that we're constraining ourselves with right now. So the vaccine and its uptake is extremely important, but so are these really boring things that we've been asking ourselves to do: wear masks, social distance, do stuff outside, don't hang out with people that you don't know. Michael Osterholm, I think said something like, stop sharing air with other people. So yeah, all of that is still important. So I hope that answers your question in some slight way.
It does, thank you.
Yes, Commissioner, I wanted to follow up kind of on the BIPOC community's hesitancy around vaccination. Just thinking specifically about North Minneapolis and the disproportionate representation of Black folks that we have in our community, and just the really bad history and even present around the Black community around the world being used essentially as experimentation for medical science. I mean, the media covered, but the media covered that European countries were looking to test the vaccinations or the vaccines in Africa. Like, there's just like this this angst around that. And so, I'm curious around how are we going to get like community influencers, like the folks who have that legitimacy of this is the right thing to do. How do we bring them into it, and how do we know that this is safe enough? Like, I think that's another question too, because it's like, oh my gosh, they said it was going to take years to develop this, and now it's already here. So do they skip over a bunch of things? Are they using us as guinea pigs? Can you maybe dig into that a little bit more, if possible?
Yeah, thank you, Chair Cunningham. One of our approaches has been to not put ourselves in the position of selling this to the community, in part because we're all still discovering things. And so to be co-discovering it with the community so that we can build our plans around what we discovered together and how it's perceived by the community. And so that's one of the reasons that we have those ambassadors that are doing that work, talking to the community, but also learning about the vaccine as information comes out. And then we ask that they, if they feel confident after all of that process, that they actually act as ambassadors as well, and help us find additional ambassadors. And I think it will be, we'll find the early adopters, and we will talk with them about sharing their experiences. And I'm heartened to see that we have a number of past U.S. presidents who have stepped forward and said that they will take the vaccine, they'll take it in public, they'll tell us about it. And so I think if we have a variety of opportunities like that to connect with willing folks who are well connected to the community, that could help as well.
Great, thank you so much. I really appreciate that. Are there any other questions or comments from my colleagues? All right, I'm not seeing any. Commissioner, I know you were juggling 2 meetings at once, so thank you for making this work today. These ongoing updates are really critical for policymakers, but also the public. So thank you for continuously taking the time to really dig in and get us that critical information. I'm sad to see that we've lost almost 300 people now due to this virus, but hopefully by increasing awareness and all of the various strategies that you and your team are looking to deploy, we'll be able to slow that down and get us down hopefully to the green zone. So, so thank you so much for that. And with that, I will direct the clerk to file that report. And seeing no further business before us and without objection, I will declare this meeting adjourned. Thanks, everyone.